Hi, this is Adriana Messa, and welcome to Reflect on and Improve Professional Practice, Session 3, Professional Supervision. In this PowerPoint presentation, we'll be looking at professional supervision in more detail because it's a critical aspect of our professional development and a key tool that we use to engage in reflective practice. It's also often an industry requirement in being able to maintain membership with our preferred association for all community workers and counsellors. So let's look at what professional supervision actually is. Most of you, when you become employed with an organisation, will receive supervision from your program manager. So you can have internal supervision within an agency, or a more senior clinician within the organisation will be assigned to you as a supervisor. However, many organisations, as part of your salary package, will actually offer you external supervision depending on your role. And this might mean attending weekly, fortnightly, or monthly supervision with an external supervisor that is either a senior clinician in your area, a counsellor, a psychologist, or social worker. So what supervision does is it promotes our ability to engage in in-depth reflection on our clinical practice and work. It ensures that we're meeting ethical guidelines and standards, and it allows us to learn and to be mentored from more senior practitioners who've been out in the field and can draw on not only their theory and knowledge, but also the skills that they've developed in practice. It's important to understand that supervision is something that needs to continue throughout our careers to ensure that we're always up to date on recent developments in the field. Now, Carroll provides an overview of the 7 key tasks of supervision. He describes these as creating a learning relationship with your supervisor. There are teaching components, so you're educated through the process of supervision. There's a counselling component in that your supervisor will be interested in what's happening for you as a counsellor or worker in your client work and how it's affecting you. There'll be monitoring of professional and ethical issues and dilemmas. There's a process of formal and informal evaluation, so looking at what you do well, what you don't do so well, and what could be improved upon. There's also consultation, so working together, problem solving on really difficult client cases. And there's also an administrative sort of component. So we're needing to acquire supervision hours to be able to have membership with an association, say like the Australian Counselling Association, the ACA. So supervision has the following 3 key functions. It's formative, so there's an educational process that enables you to enhance your knowledge and skill development. It's restorative, so it helps to minimize the risk of burnout because it encourages counsellors and workers to take personal responsibility for self-care to be able to manage work-related stress. And it's normative. It offers quality control aspects for professional practice. So it helps us to be accountable in terms of the work that we're doing with our clients. So let's look at the supervisor-supervisee relationship. The relationship between you and your supervisor is generally believed to be essential in achieving effective reflection on your practice and improving on your work. If you're in a position to be able to choose a supervisor, you should consider not only the skills you wish to develop and the type of area in which you want to develop some expertise, but also your style of learning. So this requires a high level of self-awareness. A good supervisee-supervisor relationship is founded not only on the appropriate matching of skills needed and expertise, but also on the learning and teaching styles and how compatible they are. So when we look at the qualities of a good supervisor, we're wanting someone who's going to clarify expectations and be able to discuss their process and style for supervision. They're going to maintain consistent and appropriate professional boundaries. They're going to have, specialized knowledge about current research and literature. They'll be able to teach you practical skills. They need to teach assessment and intervention with clients. They need to be able to schedule supervision frequently and regularly and in a consistent way. They need to be accessible to you and available in case you are presented with an ethical dilemma. And they need to empower you to do really lovely work rather than control you. You don't want to be micromanaged by a supervisor. You're wanting them to really foster your autonomy and to trust in your work and to be very strengths-based. So to be able to give you constructive feedback around what you're doing really, really well so that you can do more of it, but also to be able to give you feedback in a way that doesn't demoralize you or make you feel inadequate. So personal qualities is supervisors who have a great sense of humor, integrity, that are other-focused and people-oriented, that are trustworthy, honest, tenacious, committed to you, open and flexible. They're highly competent in their work. They're respected. Are people that are going to be well sought after as supervisors. Now let's look at your role as the supervisee. In order for supervision to be successful and achieve its purpose, you also have to take on some responsibilities, and they involve being clear about what you need from supervision, what your goals are professionally, and what your learning needs are, what some of your gaps are. You need to choose relevant material from client cases to take to supervision for discussion, to be willing to be vulnerable, to share your work with your supervisor in a genuine, honest and open way, to be open to constructive feedback, and to be monitored around your work, to engage in ongoing assessment with your supervisor, and to also be able to be discerning about your supervision if it's not meeting your needs, if you're not feeling challenged, if you're not taking away learning from supervision, then you need to be able to have that critical conversation with your supervisor as well in a very assertive and respectful way. So let's look at some of the things that are discussed in supervision. Initially, what needs to occur is sort of like a contracting, similar to the contracting that you do with your clients. A supervisor would contract that. So there would be a process of informed consent, talking about their process, their style, them asking you questions about what you would hope to gain from supervision. And then there would be an explanation of confidentiality and limitations and how your supervisor manages that. There'd be different issues that you'd bring to supervision. And some supervisors will say to you, I only do case management. They'll only kind of process client work with you. Whilst other supervisors, like myself, I'm really interested in developing confidence and competence in new graduates who come to me for supervision. So I'm not just interested in their client work and working through tricky sort of situations with clients. I'm also interested in their development as counsellors and community workers. So I'm really curious about their self-care, any impact, negative impact that working with clients is having on them so that I can help to develop skills and strategies for coping, etc. Generally, a reflective model is used in supervision. And there's a real clear discussion around roles and responsibilities and what goals need to be achieved. So I'm a huge believer in supervision. In my work as a child and family therapist, I've always maintained supervision. So the types of people I've seen for supervision is initially I worked with a child and family therapist when I wanted to really hone my child work. And she also happened to be an art and play therapist, so I learned an enormous amount from her in terms of using creative therapy in my work with children and young people. Some years ago, I started consulting on child protection matters, which meant that I had to present matters to the court and become an expert court witness for different complex cases for the Department of Communities. And so I went and had supervision for about 2 years with a forensic psychologist who also happened to manage court services. So whenever I wrote reports, I'd show her the reports so that she could proof and edit them and give me ideas on how to improve my writing skills and my assessment of really complex cases. Most recently, I've been working with a clinical psychologist who specializes in addiction, because in my practice, I've been supporting women exiting the sex industry who are in active addiction. And so I see Charles, my supervisor, because he just is an amazing clinician who has always specialized in addictions. So that gives you a sense of how supervision works. I also do peer supervision over coffee with my colleagues and friends who are offer me sort of lots of support. So I hope that that's helped you understand the importance of supervision in relation to reflective practice and professional development. Thank you for listening.